Hi everyone, I'm Dr. Tiffany Dzugan and I am a naturopathic doctor in the GTA. I currently practice in Burlington, Etobicoke, and virtually, serving clients all across Ontario. Today I'm going to bring you another stretch for that dreaded sciatic pain. Sciatica is one of the most painful things that I see people come in with in practice. It's terribly annoying and also totally preventable. So I'm going to teach you a really simple stretch today for those of you who are suffering from any sort of low back pain that's causing radiation down the legs. So as I discussed in one of my previous videos, there's a couple of reasons we can get that sciatic pain or the pain radiating down the leg, the sharp shooting pain. As I mentioned in my last video, that can be a product of really tight muscles that are compressing the nerve. So if that's the issue for you, then refer back to the other video for the other stretch. If that's not the case for you, and you have been told that you have either a herniated disc or a bulged disc or a slip disc or something along those lines, this is the one you want to pay attention to. So the idea behind this is that basically we have two vertebrae. So these are the bones that make up your spinal column. And between those vertebrae you have a disc, which is the soft sort of jelly thing that cushions between the bones. So those discs are fibrous on the outside and jelly on the inside. So they have a fair bit of movement. And if you have some sort of injury or there's some issue with the placement of the disc in relation to the vertebrae, they kind of slide around, and that's when they can compress those nerves, which cause the shooting down the leg. Okay, so typically when that happens, they slide backwards. The disc will actually move backwards between the two vertebrae. So this stretch causes almost like suction so that the disc gets pulled back forwards and you don't get that radiating pain. Okay, so these stretches are very famous. They're called the Mackenzie exercises, and it really is a progressive thing. You need to figure out where you fall along these lines and consult your healthcare provider if you want to give this a try and you're not quite sure where to start, because it is sort of a continuum, but I'll give you the basics and then you can decide what you want to start with. So you want to be on a flat, hard surface, probably the floor for most of you. I'm going to show you on my treatment table today. So basically you're going to start lying on your stomach. And for most of you, if you do have a disc problem, this is going to be a little bit painful, and that kind of pain is okay, although be sure with your healthcare provider that this is right for you, okay? If it's causing you a lot of pain, that's not something you should be doing without supervision. Okay, so you're going to start off with just kind of flat to the ground, and you want your arms to be kind of your hands next to your head. And the exercise is basically just to lift up your torso or your upper body to the level where you are comfortable. So some of us who don't have a disc problem, like myself, will be able to go up quite far with no problem whatsoever. If you do have a disc problem and it's protruding out the back, you can kind of imagine that that's going to trap it a little bit, and that will cause some pain. So if that's happening for you, just come up maybe to your elbows or maybe just up off of the ground until the point where you're feeling either a stretch or some pain. But the idea is, as you lift your torso up, that's creating that suction at the front that's going to pull that disc back to where it should be. So again, those are called the Mackenzie stretches. There's lots of literature available online if you're interested in learning more about them. As always, I welcome questions in the comments section below. So again, I'm Dr. Tiffany Dzugan. I'm a naturopathic doctor in the GTA, and I look forward to hearing your questions and comments.